You look and feel healthy, but are you really? The invincibility of your 20s is gone, and silent killers lurk beneath the surface, threatening your health, longevity, and even your sexual performance. These are the top labs every man should get checked before it's too late. So let's talk about the labs and tests every man over 40 should consider, especially if you're concerned about your long-term health, performance, and quality of life. As a men's health specialist, I'm often the first point of contact for men who haven't seen their primary care provider in years. So it's not uncommon for me to be the first one to discover signs of diabetes, high blood pressure, and other chronic illnesses. But the goal isn't just treating the disease, it's preventing it. And I'll be the first to say, this is a team effort. Nobody's an expert in everything, including me. So I work closely with primary care providers and other specialists in our community to provide comprehensive care to our patients. But in my humble opinion, these are the top tests every man over 40 should be getting checked regularly. Number 1 is a complete blood count, or CBC. This test looks for signs of anemia, elevated white blood cell counts, which can indicate infection, inflammation, and even some types of cancer, and also elevated red blood cell counts, which can indicate things like sleep apnea, lung disease, and even side effects of testosterone therapy. Speaking of elevated red blood counts, if you're consistently dealing with this as a side effect of testosterone therapy, and especially if you tend to snore loudly, wake up feeling tired, or feel sleepy during the daytime, seriously consider getting a sleep study. Sleep apnea is grossly underdiagnosed and can wreak havoc on testosterone production, energy, mood, and increase your risk of things like heart attacks and strokes. Number 2 is a comprehensive metabolic panel. This test looks at your fasting glucose, looks at the electrolytes and proteins in your blood. It gives an estimate of your kidney function and also gives basic tests of liver function. Number 3 is a hemoglobin A1C. This test is like a 3-month snapshot of your average blood glucose and gives us a good idea of your metabolic health. It's also not affected by fasting. This test is often used to diagnose things like prediabetes and diabetes. I also like to use this test as a measure of weight loss progress, as the number tends to improve significantly with weight loss. Number 4 is the lipid panel. This is important because certain molecules of cholesterol can damage the lining of your arteries. So on a lipid panel, you want to see low triglycerides, a high HDL, and a low LDL. Additionally, if you can get an ApoB test, this is a more accurate measurement of the specific molecules known to damage blood vessels. Number 5 is my bread and butter and arguably one of the top tests on this list, and that's total and free testosterone. Testosterone isn't just about energy and libido. Low testosterone is associated with things like metabolic disease, cardiovascular disease, depression, sexual dysfunction, osteoporosis, and even more aggressive forms of prostate cancer. There's few tests that can serve as a red flag for such a wide array of different problems. And number 6 is the thyroid panel. The truth is, problems with the thyroid can mimic a lot of the same symptoms of low testosterone, such as fatigue, weight gain, depression, and brain fog. And an overactive thyroid can cause problems like anxiety, palpitations, and a host of other issues. And thyroid dysfunction is not all that uncommon. And number 7 is vitamin D. Vitamin D deficiency is extremely common, with an estimate of up to 40% of the US population, and that rate's even higher in ethnicities with darker skin tones. Low levels of vitamin D can cause immune dysfunction, fatigue, low testosterone, and an increased risk of chronic illnesses. Vitamin B12 is another popular test, but to be honest with you, I rarely see it deficient unless somebody's had things like a gastric bypass or other digestive issues. And number 8 is uric acid. High levels of uric acid can lead to problems like gout, kidney stones, and damage to the lining of blood vessels in the heart and even the penis. High uric acid is also associated with metabolic dysfunction. Number 9 is PSA, or prostate-specific antigen. This is an important test that we use to screen for signs of prostate cancer. For men at higher risk, begin screening for prostate cancer at the age of 40. For men at average risk, prostate cancer screening typically starts at the age of 55. And check out my other video, PSA on PSA, for a detailed breakdown of prostate-specific antigen and recommendations for prostate cancer screening. Number 10 isn't actually a lab, but it's something you should check frequently, and that's blood pressure. High blood pressure is called the silent killer because there's generally no symptoms, and it's the leading cause of heart disease, and is also a major contributor to erectile dysfunction. So you may not feel it or notice it, but if it's elevated, it could be causing damage to your blood vessels, including the ones in the penis. Number 11 is colon cancer screening, which should begin for most people at the age of 45 with either a stool test or a colonoscopy. You should discuss with your primary care provider which test is best for you. Colon cancer is one of the most preventable and treatable cancers as long as it's caught early. Number 12 is somewhat of a bonus test, and that's a coronary artery calcium score. This test is good for men with symptoms such as erectile dysfunction or at high risk for cardiovascular disease, and can detect plaques in the arteries of the heart before a major event occurs. This test isn't necessary for everyone, but it can be life-saving for the correct patient. In conclusion, if you're in your 40s or older, man, now is not the time to mess around. Many of the most dangerous conditions are silent until it's too late. And there are providers out here who care about you, are not here to judge, and want to help you live a long, happy life. You owe it to yourself and your family to talk to your provider, get the screening test done, and build a healthcare team around you that can provide comprehensive preventative care and treatment. If you're not sure where to start, feel free to use this video as your starting point. Be sure to like this video and follow Strong and Hard for more evidence-based content on fitness, men's health, and sexual medicine. And as always, get strong, stay hard.